What's funny is I thought that I was about to go to school to be a nurse practitioner, but I don't think so at this point because they said nursing is no longer considered a professional degree. I'd like to see these people go to school for 2 years and get associates. I'd like them to go to school for 4 years and get a bachelor's. How about they go to school for 6 years and get a master's? And see how professional that is.
I'm gonna need the Department of Education to like find something else to do. Find another career or to mess with. Leave us nurses alone, okay?
Nurses and teachers are no longer considered professionals, according to Trump's Department of Education, along with physician assistants, physical therapists, nurse practitioners, audiologists, architects, accountants, other education degrees, social workers, other mental health degrees, and a number of other healthcare professions. And this is all to drive people towards private student loans. Because without that professional classification, well, it caps the amount of federal student aid that one can receive from the government at $20,500. If you have that professional classification, well, that's now capped at $50,000. Professional classifications include doctors and lawyers. Degrees that routinely cost $200,000, $300,000, $400,000, $500,000 are capped at $50,000 in federal student aid. The other ones are between $40,000 and $80,000 routinely, and is now capped at $20,000. This is all to drive individuals towards those predatory private student loan companies ran by private equity firms. So while the government's going to make all of us that may be pursuing an advanced degree or a degree in general poorer, they're doing so to enrich companies that are already worth.
What do you mean that nursing is not a profession? Like, are we joking here? Are we really joking? Now, dismantling the Ministry of Education is the impact is becoming so wide, because if you do not value Ministry of Education, then you can't value any other profession. What do you mean that nursing is actually not a profession? Anyway, a lot of people are reacting to it, Black Americans especially. Let's take a look at what people are saying, then I'll come back with more commentary. Do let me know what you all think in the comment section. But today's video is a wide one because I'm like, nursing. Okay, I'm going to tell you guys story at the end of the video. Let's go watch, then I'll come back with more commentary. Credit belongs to the original creators of this video. Do want to like and subscribe. Let's go watch.
I got an opinion about this. So if you guys don't know, I'm a nurse practitioner. I do possess my Doctor of Nursing Practice degree, DNP. And it's really unfortunate that the Department of Education is proposing the new definition of a professional degree program. Nursing is going to be left out, but like medicine, dentistry, I think even chiropractors, pharmacy, law is going to be included. So this means that if nursing is not included, certain advanced nursing programs will be left out when it comes to funding, like federal loans and student aid benefits. That means it's going to be affecting DNP programs, advanced practice nurse programs, nursing leadership, MSN to PhD pathways, and literally like the future of the nursing pipeline, pretty much. And for me personally, when I was doing my MSN to DNP program, I needed that loan money to survive. Mind you, I worked part-time, but I needed that extra funding from my loan to pay my tuition and to also, like, you know, to fund my life and to get through and survive school. Because if you've ever done that program, y'all already know that the weak won't survive. I was almost deemed weak, okay? Because I had like 2 semesters left of my DNP, and I sure enough was this close from dropping out if it wasn't the sake of my mother begging me not to drop out. But I say all of that to say, like, how dare they? How dare they? Blood, sweat, and tears. Like this is a very prestigious, respectable like profession that people work extremely hard for. I literally dedicated a lot of my life to finish school. I literally started from CNA all the way to DNP. So majority of my life was always like doing some work, but always focusing in school so I can be done. You know what I mean? Just to look back and know that people who want to take the same route as me may choose not to take that route, or it's going to be harder to support their life and to pay their tuition. It's going to make grad school more expensive, like it's not already expensive. It discourages nurses, future nurses, to wanting to pursue an advanced degree, undermines our professional standing, which is very disrespectful. Definitely going to worsen provider shortages, which is already a bitch. And it sends the wrong message about the value of nursing. Like, why do y'all hate nurses so much? Like, I don't get it. So I just say all that. I'm just sending love to the nursing community, people who do have these advanced degrees. It's been a lot of ruckus lately and sharing opinions with colleagues of mine and friends of mine, and it's really disheartening, and it gives out the wrong message. We do bring value, and we literally are the heart of the healthcare industry for a lot of things. Before you see a doctor, you're more than likely going to see a nurse practitioner. A lot of your your professors at school are going to be nurse practitioners. Most of them will have doctor of nursing practice degrees. So it's just sad to see how hard people work in this field and to get to this prestigious level just for it to be ripped away and for them to discourage the future of people who are in these programs or want to be in these programs. So like, we can't let the government devalue our profession. Sending love out there, stay educated, stay aware, and just know that you matter. So I don't know, I just had to get that off real quick. They never gonna demote me and what I got, because I worked hard for it, and I'll be damned.
This Black woman got up here and said that she been knew that they were going to take away the professionalism of nursing because of the fact of who they were giving the nursing degrees to. Now, all the nurses in her comments is over here acting surprised, acting like, girl, what is you even talking about? When in fact, all we see is nurses being rude to patients. Those two Black women that was also pregnant, that y'all, which one of them you kicked out the hospital and she ended up having her baby. The other one was when the nurse was at the computer and she was doing all her processing, the Black woman's pregnancy processing, and whole time she had such a disregard and negligence towards her and her pregnancy, knowing she was in labor. And so when we see these things, we always see nurses always being rude to patients. And y'all want to sit here and act like y'all surprised? Maybe it's about fucking time, because some of y'all don't care about the field that y'all in. Y'all just care about the pay and act like, oh, I need to complain about the pay because the aesthetic is not where I want it to be. When the whole time it's not an aesthetic. You're taking care of people.
So tell me you want to crash the U.S. healthcare system without telling me you want to crash the U.S. healthcare system. So the U.S. Department of Education has proposed new rules that could reclassify graduate nursing degrees, like nurse practitioners, as non-professional programs. This change would significantly limit federal student loan access for graduate nursing programs by capping the annual loan amounts at a lower level than is currently allowed for other professional degrees like MDs and so forth. So why would they do this? Let's think about this for a minute. Let's look at Project 2025. Nursing is a female-dominated profession. Nurse practitioners, DNPs, and advanced nursing degrees are overwhelmingly filled by women, about 85% according to current data. Any policy change that limits access to advanced degrees or reduced pathways for professional advancement disproportionately impacts women, and they're going to frame it as budgetary reasons. A rule doesn't have to explicitly target women for it to functionally suppress female professional mobility. Project 2025 has openly stated goals like this. They want to return to traditional family structures, encouraging women to prioritize motherhood and baby making. They want to discourage dual income households that rely on government-supported childcare. These motives aren't hidden. These are written in their public documents, right? And advanced nursing degrees give women a high level of autonomy, a higher earning capacity, and leadership roles. And that's the opposite of what traditional ideology in Project 2025 wants. Project 2025 has also repeatedly attacked fields dominated by women. Think about it. Education, 76% women. They want to eliminate the Department of Education, remove credentialing, remove federal loan protection, reduce academic research opportunities for women, nursing and healthcare. They want to shrink the federal support for DNP and NP programs. They want to re-elevate the physician hierarchy because that's more dominated by men. They want to eliminate diversity, equity, and gender-focused health programs. Social work. The nonprofit sector, 82% dominated by women. They want to cut federal block grants, restrict the Title X, shrink the public sector jobs, and eliminate reproductive health programs. This paints a consistent ideological picture to weaken female-dominated professions by reducing federal support and classification protections. Advanced degrees allow women to earn $120,000 or more a year, operate independently in many states, run clinics, engage in primary care leadership roles, reduce physician dependency models, and rolling back this pushes women out of high autonomy roles and back into subordinate and lower paid positions. And this is a complete alignment with the Trump administration in Project 2025. Project 2025 specifically frames women working in high-skilled careers as anti-family. You know, they assert that America's decline is tied to the collapse of the traditional two-parent household and that the federal government should encourage women to return to the home, and that public policy doesn't need to incentivize careerism over family life. So they're de-incentivizing women's professional advancement, and it's just been wrapped in bureaucratic bullshit. This move isn't just about budgetary problems and money, right? Federal loans are a drop in the bucket compared to other budget line items like defense and all that bullshit. They want to reduce women's high-paying degrees, reduce access to women's high-paying degrees, reinforce the hierarchical male-led professional structures like with physicians and things like that, and engineers. They want to shrink the federal support for fields dominated by women. They want to push women back into domestic, low autonomy and subordinate roles. And they want to frame it all as a budgetary discipline or regulatory reform. Project 2025 doesn't have to say the words ban female advancement for them to ban female advancement, right? And decreasing the professional designations of nurse practitioners and nursing degrees will do exactly that. This will, if this happens, completely skyrocket healthcare costs because you're going to be more dependent on physician-led models. And it's going to decrease access to healthcare for millions of Americans because nurse practitioners are the only possible healthcare option for a lot of people in rural areas. You guys tell me what you think. Like the video, subscribe to the channel, and I will talk to you later. Let me know if you think this is complete and utter garbage.
As a healthcare professional, I've watched a shift. New grads can't find jobs, experienced nurses are burning out. In fact, the Trump administration just announced that nursing is not even considered a professional degree anymore. And for a lot of these healthcare jobs, the pay doesn't even match the workload. And as immigrants or first-generation professionals, a lot of us were told that healthcare, especially nursing, would be our golden ticket. But times are changing, people. And that's why I'm teaching healthcare workers how to build income that doesn't rely on 12 or 16-hour shifts. Because in this economy, you deserve options. So comment or DM me info if you're looking for a smarter way to earn online.
Like, what is this thing? Like, what are you saying that engineering, nursing, and the rest of them are not a profession? Like, are you scrapping them or as a profession or what? Like, so who is going to work in those hospitals? Oh, you want nurses to start going to work elsewhere, like go to other countries where they will get paid very well. They will give their, services and still make more money. Now, they make this money and still be able to live well and, of course, be able to save. We've seen so many people on the internet, Americans coming out to say that, they make a lot of money. At the end of the day, they're not even able to save. They're not able to have, enough at the end of the day. For people who work high professions like nursing, doctors, tech professionals, and at the end of the day, engineers. And at the end of the day, these people come out and tell us that, I still do not make a lot of money. And I'm like, are you kidding me right now? Like, you make a lot of money and you're not able to have savings at the end of the day. Like, if you have an emergency, you don't have any money to run back to. You pay, before you know it, you're paying mortgages, you're paying utilities, you're paying this, you're paying tax, you're paying that. And at the end of the day, the money is all gone. So most of these people might be looking elsewhere. If you say that this is not a profession, who even told these people it's not a profession? So growing up, I wanted to be a medical doctor so bad. You know how they tell you, they ask you, what do you want to be in the future? I wanted to be a medical doctor, not a content creator or a digital marketer. I really wanted to be a medical doctor so bad. So I wrote my exams and I passed, right? But the school did not give me admission. Okay, they gave me admission for another course that is not medicine. And I was like, how can I spend this long and not get, like, the school system over there is, anyway, let's not even go into that. I don't want to bore you guys with that story. But at the end of the day, I ended up studying courses that were not even what I wanted to study. Imagine applying for medicine and you ended up studying economics, okay, at first. Then later I went back and did information technology. And I'm like, do you get? So that's to tell you the level of what people have to go through. But now, thank God, there's some places you can actually travel to get your degree, whatever course you want to study and all of that. Well, let me not bore you guys with the story, but everyone wanted to have a professional person in their lineage, in their family and all that. Be it a nurse, a doctor, an engineer, a lawyer. Those are like major, profession out there those days that a lot of people wanted their kids to become. Right now, a lot of people want their children to go into tech because the world is tilting towards technology, right? So now a lot of people are not telling their children, oh, go study software engineering, study this and that. But before now, it was literally medicine, engineer, lawyer. We want to have lawyer. Till today, my father still tells me, when are you going to do your medicine? When are you going to study medicine? At 30 plus years of my life. And I'm like, guy, calm down, I beg. But yeah, that was what I had in mind when growing up. Like, everybody just wanted to have that profession in their family, right? But right now we see how the world is treating. But you're coming out to say that nursing is not and engineers are not a profession. So where exactly are you going to classify them? Even tailoring is a profession. Even hairstyling is a profession. Like, what are these people even saying? Like, I'm just here wondering. When people just keep saying that if a particular administration comes up and tell you we're scrapping education, Ministry of Education and all that, you should really check them because there is an issue. Okay, there is an educational issue. Somebody needs to sit down and educate these people, right? Somebody really needs to sit there and educate these people because it doesn't even make sense. It's not even making sense at all. I'm so shocked that this can be talked about and somebody will sign it and say, yes, let's actually do it like this. Are you kidding me right now? Are you guys kidding me? I am just here wondering, like, how did we get here? Oh my God. So a lot of people are not reacting to it. Are like, there is an issue somewhere. And somebody needs to really sit down and educate these people in case they do not know. They need to understand what a profession is. You cannot come and tell me that someone who went to school for 4 years or 5 years came out with a good grade, working in a hospital or working in an engineering factory or organization, comes out and you come out and tell the person that what you're doing is actually not a profession by law. Really? In this time and age? Like, these guys need to just wake up from their dream at this point, right? They got to wake up from their dream at this point. And when I saw this content, I was like, I'm going to bring it to you guys. Let's even talk about it. Let's deliberate over it because I'm just here wondering, like, what are they even saying? Anyway, guys, let me hear your own take as well because I don't know if I'm wrong, but telling me that nursing is not a profession is. Anyway, let me know what your own take are in the comment. Let's have that conversation. Please consider subscribing if you haven't already. Credit belongs to the original creators of this video. Do well to like and subscribe. Drop your take in the comment and see you all on my next.